According to the most recent UN report on child mortality, death of children 5 years and younger in sub-Saharan Africa accounts for over half of global child deaths. In Uganda, 26% of deaths among children occur within the first year of life. This region presents unique challenges that contribute to these staggering rates. For example, the incidence of malaria is high in Uganda, and the disease can be deadly in a newborn, accounting for 10.5% of under 5 mortality in the country. Consistent use of mosquito netting can substantially reduce the incidence of malaria. The typical family in the rural villages of Uganda lives in a mud or stone hut, usually with dirt or concrete floors and no running water. Rates of bed sharing between mom, dad, baby, and siblings are extremely high because families tend to have only one mattress. Co-sleeping can put the newborn at risk for sudden infant death syndrome. One of the UN's Sustainable Development Goals is to reduce under 5 mortality rate to less than 25 deaths per 1,000 live births by 2030. To address this goal, we decided to collaborate with our long-standing partners at Claire Clinic in Kasoro district of Uganda to implement an interventional program geared towards newborn babies. Our program is modeled off an intervention first utilized in Finland, one of the countries with the lowest rates of infant mortality worldwide. As part of the program, expectant moms qualify for a government-supplied box of necessities for newborns in return for visiting a prenatal clinic or doctor before their 4th month of pregnancy. The box also contains a mattress and doubles as a crib, providing a safe sleeping environment. Baby boxes have been used in Europe and the US, but we decided to modify the traditional box to fit our unique needs of sub-Saharan Africa. Our hope was that implementing a similar model in a resource-limited setting, like rural Uganda, would result in safer sleeping practices for infants. We hope this will reduce co-sleeping related accidental injury and death in newborns and prevent malaria transmission through consistent bed net use. We also saw this as an opportunity to improve health engagement with the health system by encouraging more women to deliver at a clinic rather than in the home, which is very common in this rural region, and to feel more comfortable seeking help from a healthcare provider. After carefully testing different models on site, we found that wood boxes, handcrafted by a local carpenter, were most accessible, economical, and practical for withstanding the humid, tropical climate. The box contains the following items: a printed fabric box cover, hand-sewn at a local shop, which can be unzipped and washed, a foam mattress, which fits snugly into a plastic sleeve, a fitted sheet to cover the mattress, a mosquito net to fit over the box and a fabric band to keep it in place, a knit blanket, and clothing donations. We piloted the program by building and equipping 40 boxes. We recruited women in the community who had recently delivered at Claire and whose babies were 3 months or under. Midwives from the clinic taught participants how to use the box correctly and instructed them how to return the box once the baby has reached 6 months of age. Further, each participant received a short set of verbal instructions on safe sleeping practices for their newborns. The clothing and blankets were gifts to moms for participating. In 2 months, we distributed 31 boxes. 2 weeks after receiving the box, we performed a brief home visit to gauge if women were using the boxes, and if so, if they were being used correctly. The majority of women responded positively to the boxes, and 74% reported that the baby now slept exclusively in the box at night. Many reported that they liked that the box is portable, allowing them to keep the baby close to them in a safe environment while they complete chores around the house. Based on the success of our pilot, our goal is to make this program sustainable at Claire Clinic and to collaborate with other clinics in the Kasoro district who have already expressed interest in establishing their own baby box programs. In the long term, we would like to scale this project up globally to other resource-limited settings where child mortality is high. Sustaining this project will not only stimulate local economy, creating jobs for carpenters and seamstresses, but it will also promote healthy behaviors and increase engagement with healthcare systems. In order to expand this project, we are seeking advice from partners in the U21 network on how to best implement scalability in resource-limited environments. Networking opportunities with appropriate industry and health organizations in sub-Saharan Africa would be extremely valuable. We hope to discuss how to best utilize local resources on a large scale and maintain a sustainable and high-functioning program in a healthcare setting.